You're much more comfortable doing this tonight. I said you're much more comfortable and familiar with doing this tonight. Like, I can talk about it.
Okay.
Like, following the script and, like,
yeah. Well, and I made the PowerPoint, so I'm more comfortable with it. All right, are we ready?
Yep, ready video.
I'm ready.
Tell people to mute themselves.
Okay. Hi, everybody. Thank you for joining us. We would ask that everybody mute themselves. We do have you all on mute right now. And we will later be opening up for questions, and then we'll be able to hear everything in the background. So if you mute yourselves now, we won't have a problem with it in the future. Thank you for joining us. My name is Heather Hallman. I am the Senior Advisor to the Secretary for the Department of Public Welfare. And today I have with me
Nicole Silks from the OIM Bureau of Policy.
So hopefully we'll be able to answer all of your questions about Healthy Pennsylvania today. So to get started, and then also what I do want to remind you, if you have any questions, please just message us on the chat line, and afterwards we'll try to answer those questions for you. All right, so to get started, Healthy Pennsylvania is a comprehensive plan that ensures that Pennsylvanians have increased access to quality, affordable health care. So it's an overarching broad plan for Pennsylvania. And just to remind you, probably have all heard this before, but Healthy Pennsylvania, it's about getting all kids insured. Probably it was about a year ago, legislation went through the House of Representatives to eliminate the 6-month waiting period that children had to go without health insurance before they could qualify for CHIP. They also, we've been promoting access to primary health care through the Department of Health. They have been working to keep primary care physicians in Pennsylvania. Through enhanced care delivery through technology, what we've been doing is we've been working with our Office of Medical Assistance Programs to allow for consultations through telemedicine. We're one of the first states to allow that. Supporting older adults and persons with disabilities, the Long-Term Care Commission has been meeting for the last year. A report is due out December 31st to make recommendations on how we can improve supports for older Pennsylvanians and persons with disabilities. We've also been doing ensuring safe and appropriate access to prescription medications. We are the state with the most drop boxes for medications, so that once your outdated prescriptions, they don't just sit in your medicine cabinet, or people aren't throwing them in the water system or in the trash. So we have more drop boxes in Pennsylvania than any other state. And then of course we have reforming our Medicaid program, which is what you guys are here to listen to today. So Healthy Pennsylvania is about increasing access to 600,000 Pennsylvanians. We're looking to improve our health outcomes. We want to match benefits to the healthcare needs. We want to increase responsibility, and in order to do that, we want to reform our Medicaid program. So there's several new components that we have that will be introduced in January 2015. First, we have our simplified benefit structure, which we will be talking a little bit more. And we also have health screening, newly eligible adult group, and our healthy behaviors. So here's our simplified benefit structure. What we've done, I think you probably all know that we currently have 14 adult benefit packages. Those adult benefit packages are not necessarily matched to an individual's need. It's more matched to a categorical eligibility category for them. So what we've done is we've looked at individuals who are low risk, and those individuals we place into our healthy plan. So this is for adults aged 21 to 64 who do not have complex healthcare needs, and they are eligible for Medicaid. We also have our Healthy Plus plan. These are for individuals who do have complex healthcare needs. We're talking about medical or behavioral health needs and pregnant women. This includes pregnant women. And we're talking about adults over the age of 65. So anyone over the age of 65 is automatically placed into our Healthy Plus plan. We administer this through our current Health Choices managed care plans. So a lot of individuals who are currently on Medicaid won't even see a change. They'll just be placed into one of these two benefit plans. Many of them today don't even probably realize what benefit plans they're in. What's also important to note is that there are no changes to our children's benefit plan at all. So, what's covered on Healthy and Healthy Plus? So they both meet federal standards for our benefit coverage, including mental health and drug and alcohol parity. Our Healthy plan is actually mirrored off of our current state plan amendments, or our current state plan that we have with the federal government. And our Healthy Plus is based off of the standard plan, the benchmark plan that the federal government established for Pennsylvania. And our Healthy Plus plan mirrors that. When we talked about what kind of benefit limits we would have for each of these categories, what we looked at is individuals who currently utilize that service and looked at what would meet that 90th percentile benefit coverage. So the individuals who currently utilize that service, what would 90% of them be utilizing for that? And in many cases, when we developed our benefit structure, we actually are meeting 95 or 100%. Just recently on healthypa.com, we released a draft of the benefit structures for Healthy, Healthy Plus, and the private coverage option. So probably all of you right now are clicking onto the website to look at that benefit plan. If you go to healthypa.com and click Consumer Resources, you will see the draft benefit structure on there. So, how do we determine if someone is eligible for Healthy or for Healthy Plus? What we've done is we've developed a health screening. First, we look at claim data that we have for individuals that are currently in our program. We looked at those and we determined whether or not they have complex healthcare needs. For individuals who we either did not have enough information for, or for newly eligible individuals, they will go on and take a health screening. That health screening just helps us to align them to the appropriate benefit plan. It's really the basic healthcare questions. So it's really similar to what you probably fill out today when you go to your doctor's office. Any questions can be skipped. It's completely confidential. And completion of the tool is not required for eligibility. So if an individual chooses not to take the healthcare screening, all we will do is utilize the information that we have available to us to make the best determination. And so who will need to take the screening? Adults who are aged 21 to 64 who are applying for Medicare or private coverage option will be asked to complete the screening. Again, that is completely up to them whether or not they choose to take it. Anyone under 21 will be placed into our children's benefit plan, so they don't need to take that screening. And anyone over the age of 64 will automatically be placed in Healthy Plus, so they do not also need to take that screening. In addition, pregnant women, individuals on SSI, individuals who are applying for our Medicaid home and community-based waiver services, and individuals who are residing in institutions will not need to take the screening. So, here's an example. We have a household of 4. We have Mary, who is not receiving SSI benefits. She's age 30. Joe, who is receiving SSI benefits, who's 35. Sally and Jimmy, who are 10 and 5. So out of those, I'm sure you're all guessing who would be the individual to take the health screening. And it would be Mary. She'd be the only one, if she went onto Compass and applied, she'd be the only one asked to take the health screening. And Joe and the children would not need to, because Joe would automatically be placed into Healthy Plus and the children would automatically go into the children's plan. Again, if Mary chooses not to take the health screening, we would automatically place her into Healthy or the private coverage option, or utilize other data that we might have available to us to make another determination. So,
she's going to pass it off to me.
I'm passing it off.
And I'm going to talk about the new Healthy PA components. So first what we're going to talk about is we're talking about the Healthy PA newly eligible. And those are adults ages 19 through 64 with income less than or equal to 133%, and they're not currently eligible for Medicaid. And so, as an example, to give you an idea of where the 133% limit is, it would be approximately $15,500 annually for an individual. And the monthly eligibility limit is $1,294, so that gives you an idea for a family, for a single adult, childless adult would be $1,294 a month for them to be eligible for the new Healthy PA. In order to increase access to health care coverage for Pennsylvania, Healthy PA created this private coverage option. The private coverage option introduced a private market health insurance plans for newly eligible individuals with income up to 133%. The plans are similar to the employee-sponsored coverage, and it provides the essential benefits for approximately more than 600,000 eligible Pennsylvanians. Now, as Heather mentioned before, talking about the health screening, when those individuals screen what's called screen high, or they're determined medically frail, they're going to be placed in what's called the Healthy Plus benefit plan. And medically frail includes individuals who have the items listed below. They have a disabling mental disorder, chronic substance abuse, and a complex medical condition. And Pennsylvania is using the federal definition of what is considered medically frail. So, Pennsylvania is providing a specific plan for each Pennsylvanian who is eligible for medical assistance. Low-income parents and caretaker relatives with incomes up to 33% are going to fall into the traditional medical assistance. There are vulnerable Pennsylvanians, the children, and medically frail individuals. The other option, the private coverage option, which we're introducing with Healthy PA, is going to cover the childless adults, the adult parents and caretaker relatives with incomes up to 133%. This is that newly eligible population that couldn't receive medical assistance before. So, the health screening, you can either screen high or you cannot screen high. And when you screen high, you will be placed into a Healthy Plus benefit package, and your results will be validated by a clinical validation team. If you don't screen high, you're going to be placed into the Healthy benefit package.
So in this example, we have a father who has a child and a mother who has two children. They both are approximately 30% of federal poverty level, so they would qualify for traditional medical assistance. The father here, he screens high, so therefore he'd be placed in the Healthy Plus plan. And the mother, she did not screen high, so we would place her into the Healthy plan.
And then the other example of how the health screening would impact individuals who are going into the private coverage option, George is single and he has an income of 110%, and he screens medically frail. Because he screens frail, he will be placed into the Healthy Plus traditional medical assistance program. Then we have Naomi, who is a single adult and has an income of 110%. But when she took the health screening, she screened not medically frail, so she will be placed in the Healthy PA private coverage option.
And so we had a question about our health screening, and the question is whether or not the healthcare provider needs to sign the screening tool. No, they do not. This is a tool that solely needs to be completed by the individual, so it does not need to be completed by a healthcare professional in any way. The only thing is that once an individual screens, if they screen high, they will automatically be placed into that Healthy Plus plan. They'll stay in fee-for-service, so they will not go into the managed care organization right away. They'll stay in fee-for-service until our clinical validation team, which is a team of nurses that we have on staff, will go through and they will validate the results of that. In order to validate it, they will look at any claims data we may have on those individuals. They will contact that individual, and they will likely contact the primary care provider for that individual to talk about whether or not they need to be in the Healthy Plus plan. So, but there is no need for the provider to actually sign the health screening. And for all of those of you who have asked if this presentation will be available afterwards, yes, it will be. We are recording it. It will be available on your website. Okay, so cost sharing for adults. So individuals who are in the private coverage option and in Medicaid, they will continue to pay co-payments as they're outlined in our current program. So as you probably know, those co-payments range today from $0 to $3.80 based on the service that's provided. The only change that we have in year one is that providers can choose to refuse service to individuals over 100% FPL who do not pay their co-payment. Now, the only time the service provider can do this is if the service provider has that across-the-board blanket policy for all individuals that they serve. We've also had a lot of questions about how does a provider know this. When an individual comes in, providers every time are supposed to check in our EVS to make sure that the individual is still covered under Medicaid. It'll also show what copayment is available to, or what copayment that individual would be paying. And then it will also have an indicator as to whether or not they're over 100% FPL, and therefore the provider would at that time be able to refuse service for not paying the copayment. In year two through 5, individuals who are above 100% FPL, they will pay a premium. Co-payments will be eliminated for those. And then the only co-payment that they would pay is a co-payment that will be starting in year 2, which is an $8 copay for non-emergency use of the ER. Individuals who fail to pay their premiums for 90 days in a row, those individuals would be disenrolled. There is no blank period for them, so they'd be able to re-enroll the next day, but we would be able to disenroll them for failure to pay their co-payments. Additionally, individuals who are under 100% FPL, they'll continue to pay their co-payments as they do today. We'll be collecting that information, because remember, this is a demonstration project with the federal government. So we are looking to see, we're doing research and we have hypotheses around this. We'll be collecting that co-payment data and supplying to the federal government to see if we can move towards premiums in the future for these individuals. And like individuals over 100% FPL, we will be having an $8 co-payment for non-emergency use of the ER. So part of our personal responsibility aspect of Healthy Pennsylvania is our healthy behaviors. We want everybody to go to their primary care physician for their annual wellness visits. I just did mine last week, so it's important for all of us to do that. If an individual this year goes for their annual wellness visit, next year we will reduce their premiums or their co-payments to reward them for that healthy behavior. If they also meet all of their cost-sharing obligations, so that's paying their co-payments when they go to the doctor or paying premiums for individuals on MAUD, in year 2, we will then also reduce their cost-sharing. Another aspect of Healthy Pennsylvania that's really unique is our encouraging employment. In year 2, we will make available to individuals job coaches, Healthy PA job coaches, who will help individuals to find employment. Excuse me, can somebody please mute their phone? Thank you. We will encourage individuals to seek employment. This is completely voluntary and is not a requirement for eligibility. So, I'm sure all of you are aware there is no wrong door for applying for healthcare. They can go on and apply at Compass. Individuals can call our Consumer Service Center, where we have staff on call on the phones to complete it through the Compass website for those individuals. There's also the paper application. And the health screening, starting December 1st, will be available as an appendix to the paper application. Additionally, individuals who go through the FFM, apply through healthcare.gov, They will be transferred to us once they are, and if they're deemed that it's necessary for them to complete the health screening, they'll then be given an option at that point to complete the health screening. But remember, if they don't complete the health screening, they will just be placed either into healthy or to the private coverage option. Finally, timeline. So you probably have already seen these. Individuals have been receiving letters since about the beginning of November. We have been sending letters telling them, hey, in December, there are changes that are going to be coming. So individuals who automatically, through our claims data, went into the Healthy Plus plan, they got a letter saying, hey, you're going into Healthy Plus, you don't need to do anything, but we're just letting you know about that. Individuals who were found eligible for Healthy or for the private coverage option received a letter that said, that told them that and then gave them the option of completing the health screening. They have until, I believe it's November 24th, to complete that health screening. Now remember, if they don't complete the health screening, we would continue just to place them either into Healthy or the private coverage option. If their healthcare needs change, or if they should have completed it and they chose not to, and later realize that they need a more robust healthcare plan, all they have to do at that point is raise their hand, and they go to their county assistance office, and they tell them that they feel that they need to probably be in the Healthy Plus plan. We'd complete a form at that time and validate it with the clinicians and the primary care providers. And then if that individual is deemed eligible for Healthy Plus, they'd be moved into Healthy Plus. Notices of transition will be sent in December for these individuals. And also in December 1st, we open up enrollment for the private coverage option. January 1st, all of our changes take effect, and individuals will be placed into their private coverage option for those that are eligible for that. So, that is the end of what we have for presentation. I think there's a couple other questions, though, that you probably have, and I'll just take care of those right now. Number one, probably a lot of you are hearing a lot about the change in governor and that Tom Wolf would like to see expansion of Medicaid. We are continuing to go down this path. I think all of us, Governor-elect Wolf and Governor Corbett, would like to see individuals have health care coverage starting January 1st. We are working our best with both teams in order to ensure a smooth transition, and no matter what, to ensure that individuals maintain coverage. So we are continuing down this path, and we're asking people to just bear with us as we go through this. Additionally, you might be wondering about Select Plan. Select Plan, for those of you who don't know, is a limited benefit package. It's mostly family planning services. And for the women that are on Select Plan, it does not meet the federal requirement for essential health benefits. Because of that, and because the waiver is actually set to expire December 31st of this year, we have decided to extend that waiver for 6 months so that we can give these women an opportunity to transition, and so that we can have the time that we need to use the information that we have to determine whether or not they're eligible for the private coverage option or for Healthy or Healthy Plus. So we will be doing that over the next 6 months. And if you know of anybody who is in Select Plan who does not have full coverage, please encourage them to either go onto Compass and apply, or go into the FFM and apply for full health care coverage. So we also have a few other questions that we will go through. First, there was a question ahead of time that was supplied to us. They've heard that Compass will be down November 28th, and that applications that were not submitted before that, that they will be deleted. That is true. That weekend, starting actually Thanksgiving Day through that Sunday, our staff will be working around the clock to update our Compass system and ESIS, so that starting December 1st, we can start taking applications for Healthy Pennsylvania. Any applications that are not submitted prior to that will be deleted. There's currently a notification on the website letting people know that. But if you know of anybody that has not submitted an application and has it just sitting in no man's land right now, please encourage them to submit that. Additionally, we had the question as to whether or not maintenance will be happening anytime before January 1st. The only other planned outage that we have is December 27th and 28th. We will be working on implementing our child welfare information system, and because of its link to Compass, there will be periods of outage that weekend, and at that time a maintenance page will be put up. We also had a question about individuals who are up to 138% of FPL and who are currently at the FFM. So if an individual is currently at the FFM, they're up to 138% of FPL. And we did have the question about the 5% disregard. Yes, we say 133%, but there is a 5% disregard, so individuals up to 138% would qualify. Anybody who's currently in the federal marketplace getting the advanced premium tax credits, they would need to apply for either notify the FFM and let them know they want redetermination, or they need to come into our door and apply. We're working with the federal government right now to figure out how we can notify those individuals to let them know about this. So we're currently in that process. Individuals who are currently receiving advanced premium tax credits, who then apply through us, will need to contact either the FFM or their insurance company and let them know that they are changing over to Medicaid. There's not that we do not have the ability, and the federal government does not have the ability to take that information from us to just automatically do that. If somebody applies through healthcare.gov, however, and they are deemed eligible for Medicaid, that information is transferred to us. We then will process it, do the eligibility determination. We then redirect that back up to the FFM and let them know that we have adjudicated that. And if an individual is receiving APTC, that would then be canceled at that point. All right, we also had a question about whether or not the PCOs that were listed is a complete list. Yes. If you go into healthypa.com, you can actually see a map, and it has all of the PCOs listed. There is also a question as whether or not you can go on and shop ahead of time. If you go to enrollnow.net, there is an opportunity to go and shop at the PCO plans. That is to be up today. As of me getting here, it was not up and running, but it should be up today at some time. So, question about what the definition of medically frail is. We're following the federal definition of medically frail. So, you saw the list when we went through that slide, but if you want to see a more in-depth definition, you can go into healthypa.com and look at our 1115 waiver demonstration application. The complete definition is there, and you can also go onto CMS's website and find the complete definition. We had a question about, please explain the process for determining high-risk eligibility when consumers are submitting their application. Will DPW follow up or need to coordinate with primary care providers? And we'll be providing any guidance to providers. As we said earlier, if an individual screens high, our clinical validation team will then contact that individual and contact the physician to validate those results. And again, we will be sending out some guidance around that in future bulletins to providers so that they know what to expect when the validation team contacts them. What happens if a consumer refuses to complete the health screening? They will just be placed into either the Healthy or the PCO plan if we don't have claims data to place them into another, into the Healthy Plus plan. Again, at any time they could go back and raise their hand and ask to be reevaluated. We had a question about, can you provide us insight into processes or timelines that CEOs will follow for healthy PA enrollments? We will be following the same timeframes that we have today. And final question that we received ahead of time, is there a publicly available comparison chart listing the benefits included for Healthy PA? Yes, and that is available on healthypa.com/consumer resources. So, now we have a ton of questions that you guys have been sending in. I'm going to give half of them to Nicole, and we'll try to get through these.
So the first question that we have is, what is the new deadline for Select Plan? The application deadline for Select Plan is December 31st. Individuals can apply for Select Plan up through December 31st. During the time from December 1st through December 31st, if we receive an application for Select Plan, the individuals will be reviewed not only for Select Plan but for Healthy PA coverage as well. And their Select Plan coverage will end as of December 31st. If they're not eligible for any other Healthy PA or traditional medical assistance, they will be referred to the FFM so that their application can be reviewed there.
Let's see. If the physician does not validate the information on this health screening form timely, are consumers placed in Healthy automatically, even if they identified complex health issues? I'm going to be honest, I do not know the answer to this one. We will follow up. I would assume that yes, they would be, but remember that what is important about this is that both Healthy Plus and the private coverage option, they all meet essential health benefits or the federal standards for healthcare coverage. So an individual who is in the Healthy plan, even if they do have more complex health needs, they will have a benefit plan that should meet their needs initially. We also, something I forgot to tell you guys, we will be looking at claims data 3 times a year. And 3 times a year for individuals that are in Healthy, we'll be validating that claims data, and if it shows that they have a complex health need, we will automatically transition them to Healthy Plus. We won't be able to do that for the private coverage option, but we will be able to do that for Healthy. And remember, at any time they can raise their hand and ask to be reevaluated. How long will it take someone to switch from Healthy to Healthy Plus if needed? Again, it really depends on how quickly we hear back from providers, but we hope to make that happen quickly. But no matter what, that individual will have healthcare coverage that should be meeting their needs.
Okay, and then we have our next question. What happens if a consumer's application is forwarded over from healthcare.gov and they are then deemed ineligible? Do they then get to shop in the marketplace and receive a tax credit? If they are sent over from healthcare.gov, they have our rules in place, and if they're under the 133%, they'll come to us to be evaluated. And based on that, they should be eligible for a program in Pennsylvania. If they weren't within our income limits, they would have stayed at healthcare.gov, and they would have been received medical through the federal marketplace. And the next question is, does the 5-year waiting period for lawfully present immigrants apply to the private coverage option of Healthy PA? And I have that response. I just need to pull it up. So lawfully residing immigrant adults who have not been in the country for 5 years with incomes below 400% of FPL and do not have access to affordable employer-sponsored insurance will be eligible for subsidized coverage in the health insurance exchange. Those with incomes below 138% of the FPL are not eligible for Medicaid coverage, but can qualify for exchange subsidies if they pay 2% of income. Under the State Plan Amendment 920, Pennsylvania does cover children and pregnant women subject to the 5-year bar, but other individuals subject to the 5-year bar could only be eligible for emergency medical assistance. and those individuals are not eligible for federal Medicaid benefits.
Great. All right. Okay, so I had a question. So consumers that applications are forwarded over to Medicaid from the marketplace, will they receive a phone call from someone? What do you tell individuals to do in the meantime? So if an individual, if we get a call or if we get the application from the FFM, the only time they would receive a phone call is if we need more information and that the caseworker decides to reach out to them, or if for the health screening we need to validate their that they are Healthy Plus. What do you tell individuals in the meantime? If an individual applies through the marketplace, it should come over to us very quickly. The account transfer process has been working much better than it did last year at this time. And so it should be coming to us. Remember that there is retroactive coverage. So if an individual is in that waiting period and they are deemed eligible, they can go back up to 3 months. Now that starts January 1st for the newly eligible population. So don't forget that we can't go beyond those we can't go earlier than January 1st for individuals that would not have been eligible before that time period.
Next question. What if a patient comes in now for urgent needs and gets Medicaid? Will they have to re-enroll for PCO December 1st, or will they automatically be placed in a Healthy Plus package? If they come in and are determined eligible now prior to December 1st, they will be part of our transition weekend and will get a notice in December stating whether or not they have been transitioned into a Healthy PA package, whether their category transitions them into the Healthy Plus or the PCO. So if they are currently receiving medical assistance at the time of the transition weekend, they will be transitioned into the appropriate medical category. They will also get a notice stating whether or not they wouldn't be transitioned, and at that time they can either reapply for benefits or apply through the FFM.
Okay. Next question was, what if a person fails to complete the health screening by November 24th? If they fail to complete this health screening before November 24th, and they do believe that they have complex health needs, all they need to do is contact their county assistance office and let them know. That's our raising the hand process. And then we would go through the validation process for those individuals.
Okay, who will be responsible for completing the application once it is submitted? How long will it take until a decision is made? And what about verifications? So each individual CAO will be responsible for completing any applications submitted that are assigned to that county. How long will it take to make a decision is in line with the 30-day time frame that we have currently. The same time periods will exist. And for verifications, it will be the same process. If an application is submitted without the pending verification that we need, we'll send out the pending list requesting the information that is needed, and they'll be given the current 18-day time frame to get that information back into us.
All right, our next question was, will individuals choose their health plans the same way as it is now with MA by receiving a form with a list of insurances to choose from? It will be the same as it is today. They can go through our enrollment broker and by calling them or through enrollnow.net.
Okay, so will available employer coverage affect eligibility for Healthy PA? Again, with traditional medical assistance, it would be the same that it is today. It will be reviewed to see if they have employer coverage that the state can use. But for those that are in the PCO, employer-sponsored coverage won't take effect until year 2. They won't be eligible for that until demonstration year 2.
They'll still be eligible for the private coverage option.
For the private coverage option, but looking at whether or not the employer-sponsored health care may be a cheaper alternative for Pennsylvania rather than PCO won't take place until year 2.
Right. We will not have the process up and running yet to look at that and whether it's cost effective. Are the copays different for Healthy and Healthy Plus? No, they are the same copays, and they're the same copays that individuals pay today. We had the question to please restate the information regarding Compass maintenance and pending applications. And so Compass maintenance, starting on Thanksgiving Day, that morning we will be, so the system will be down pretty much the entire weekend as we go through updating Compass and ESIS. Any applications that were pending at that time, so any applications that were not actually, the person didn't click submit, those applications will be deleted. This is the same thing that happened last year when we, or 2 years ago I think at this point, where we went up with the Affordable Care Act. It's the same process, or no, it was just last year with the Affordable Care Act. We will need to delete those, but individuals can then come back in December 1st and start to apply. And also the weekend of December 27th and 28th, we anticipate outages. It won't be down the whole weekend, but there will be periods of outages as we work on our child welfare information system.
Okay, so the next question is, do we need to wait until December 1st to apply for anyone, or as long as we submit the application, it will not be deleted? As long as you submit the application, it will not be deleted. And for those that are applying for people who they believe are eligible for the Healthy PA benefits as of December 1st, if you submit an application now for medical benefits only, the CAOs have been instructed to hold any applications received from now until November 30th and wait to process those until December 1st so that they're processed through the Healthy PA eligibility rules. So if you submit a medical assistance only application, that will be held so that it can be determined under the new Healthy PA eligibility rules on December 1st. And again, as long as you submit the application through Compass prior to November 26th, it won't be deleted. As long as you submit it and it goes in.
Okay, so, a follow-up question for an individual being forwarded over to Medicaid. So tell these individuals to wait to hear from someone by phone call or by mail. These consumers are nervous. Some of them already have health care through the marketplace but are now eligible for Healthy PA. They are asked if they need to cancel. So if an individual, if I'm getting this right and if I'm wrong, Belinda, hopefully you can correct me about your question. So I think you're talking about people who are currently receiving APTC through the federal government. These are individuals between 100 and 133% FPL who currently are receiving health insurance through the marketplace. If these individuals are currently receiving APTC, they need to do something. They need to contact the marketplace and ask for a redetermination, and because what's happening is the federal government is not going to be, as of right now, they're not going to be contacting these individuals. We're currently working with CMS so that we can send them a letter and let them know that we need them to come in through our door or to let the FFM know. So we're working on that process right now, but if you know of individuals in that bucket right there, the 100 to 133 that are currently in the marketplace, but would like to come into Healthy PA, then they need to contact the FFM about that. So they should not just sit back and wait, because we won't be given that information unless they do something.
So next question is, will dental be included? Dental is included in the Healthy and the Healthy Plus packages. It is up to each individual PCO as to whether or not they will cover that as part of their package. Dental is not considered part of the minimal essential healthcare coverage, so it doesn't have to be included, but some plans may choose to include that in their package. And when you go to the enrollnow.net to shop around, you should be able to see whether or not that plan offers it.
All right, so now the next question is, what happens when a patient exceeds the lab annual dollar cap or or the hospital admission cap for plans with limits? Is care denied? Does the patient get the bill for excess amount? How does the clinician know what benefits has the patient has used to date? So remember that today we actually have benefit limits, and so as like we have today, they would do the same process for reaching those benefit limits. If an individual does meet their benefit limits, they can submit, the physician can submit for a benefit limit exception as we have today. Another thing that's really important to note is that we have done a lot of research on this and analysis, and individuals who meet certain criteria will automatically be given that benefit limit exception. We are currently developing an easy to look at guide for that. We're hoping to have that available next week. It'll be on healthypa.com when we do have it available, so that you're going to be able to see what automatically qualifies for that benefit limit exception.
Okay, next question is the health screen now available through Compass for current consumers or for new applicants? For current consumers, those that received a pre-transition letter telling them that they would be moved to the Healthy package or to the private coverage option, received a letter and an invitation to screen. And those individuals are able to go either to the Compass website and choose the health screening, or they can call the Consumer Service Center for assistance to complete the health screening on the phone. For new applicants, the health screening is not available yet. That won't be in the Compass workflow until December 1st. I did mention earlier that you can submit an application and it will be held until December 1st for processing for medical benefits only. What will happen then if you do submit an application before December 1st, the application will be, that applicant will receive a health screening, the opportunity to health screen in the mail. They'll be given the Compass website, or they'll be given the phone number, and they'll be given the phone number for the Consumer Service Center so that they can call to health screen. Again, eligibility isn't determined by the health screening, so they can choose not to complete it or they can complete it. It just determines what benefit package they would be put into, so we encourage everybody to complete a health screening.
All right, so the next question I got, if they choose a health plan that their provider does not accept, can they change at any time by calling PA Enrollment Services? First, we encourage everybody before they choose a plan, we encourage them to make sure that their primary care provider is working with that plan. But if for some reason they need to switch, for individuals in Medicaid, they can switch at any time. For individuals who are in the private coverage option, they will be, once they select their plan, they have 3 months in which they can switch that plan. If they do not switch it within those 3 months, they will need to wait until January 1st to switch their plan. We'll have an open enrollment period again next year, just like you have with healthcare.gov. There will be an open enrollment period starting probably November of next year for individuals, then to start January 2016.
The next question is, will vision services be included? Based on the benefit chart comparison that's on healthypa.com, eyeglass lenses are only limited to individuals with aphakia. I don't know if I'm saying that right, but and that's for the Healthy and the Healthy Plus package. For the PCO package, again, it's much like the dental coverage. If the PCO plan chooses to cover vision, it will be listed on the enrollnow.net on their in their package.
Okay. Let's see. If there is no wrong door due to identity verification on the FFM, would this remove the need for verification process for state Healthy PA insurance? I'm going to be honest, I don't know the difference between the processes for verification. We actually utilize a lot of the tools from the FFM. So I'm going to be honest, if you want to send me more information about that, we can try to answer that question better for you. But I honestly not sure what you're talking about. So we apologize for that, but if you want to email me, you can actually do it through healthypa.com. Any of you that have questions, if you go on there and scroll to the bottom, there is a FAQ email address that you can actually email directly to. So, I didn't do that. No, I didn't do that. Okay.
If someone is already enrolled in Medicaid, will they need to enroll through Compass on December 1st? No, they will not need to re-enroll through Compass on December 1st. Everybody that is currently enrolled in Medicaid will be transitioned to the new to their new program or their new benefit package, and they all receive pre-transition letters, and they will all receive transition notices in December, letting them know of that. And also, the same for a child who has CHIP. Let's say their parents are eligible for APTC through Marketplace, but the child who is already on CHIP is still eligible for CHIP. How should one go about renewing their CHIP? If the child is enrolled in CHIP, they will receive their renewal package the same way that they have in the past. There is a transition happening in December that is reviewing children in CHIP who are under the 133% limit that could now be eligible for Medicaid based on the new income limits, and they will be transitioned into a Medicaid category. And letters have gone out for those CHIP recipients who will be transitioned. They have been going out over the summer, letting them know that if there's a need for them to choose a new provider. I believe letters have been sent out since August. So if a child is enrolled in CHIP and they remain eligible at the CHIP income limits, they'll stay eligible at the CHIP income limits and receive their renewals the same way that they have. If they fall under the CHIP income limits, they're going to be transitioned to Medicaid in the month of December. Next part of the question is, should they wait until they receive paperwork through the CHIP in the mail? And yes, that's how it would work. If CHIP has information to give them to renew, they will get it from CHIP just as they do today. While enrolling the parents in the Marketplace, should we go ahead and re-enroll the child through Compass at the same time we are enrolling the parents in the Marketplace? And you only have to renew the child if they have a renewal packet that needs to be completed. To be honest, I'm not sure that if you do that or not, but if they have a renewal that needs to be submitted, then it can be submitted. You don't have to re-enroll them at the same time you're re-enrolling the parents at the FFM.
We have the question, when and where will the video for this conference be available? We are hoping to get a copy of this to your organization today or tomorrow morning. And then it'll be available at www.pachc.org is my assumption, and Jim probably can correct me if I'm wrong with that. But it will be available then.
Okay, for example, a consumer makes $13,000 a year for a family of one, and normally they would receive a tax credit, but now they're being told their application is being forwarded to Medicaid. They are not sure what to do, and I am not sure what to advise. Basically, their application is going to be forwarded to us, and we will review them for eligibility under the new Healthy PA rules, because the yearly income limit for a household of one is $15,500, I believe, so they would fall under that 133%, so they would now be eligible for Pennsylvania eligibility rules under Healthy PA. So you can just let them know that their application has been forwarded to us and it will be reviewed for eligibility through Pennsylvania.
All right. We had the question if we will still use Promise for eligibility. That one's an easy one. Yes, we will.
Okay, and what are the reporting requirements? If the individual circumstances change, is eligibility for a year or more frequent renewals? It is an annual renewal, much as the same for the MAGI categories under the ACA that we have now. If the individual circumstances change, they would report any changes based on what's in their rights and responsibilities and what they're required to report based on their category. And again, the eligibility is for a year.
All right, and I'm forwarding yet again a tougher one to Nicole.
And is there a resource limit for Healthy PA? There is no resource limit for Healthy PA. The resource limits are still in effect for the existing Medicaid categories, and if pregnant dreamers can apply for Healthy PA. I received a similar question to this earlier today, and I will be honest, I had to look up what a dreamer adult was. And based on what I saw, a dreamer adult has been in the United States. Dreamer adult is an immigrant who has been in the United States for at least 5 years. So they are outside of the 5-year bar. And Pennsylvania does cover pregnant immigrants. So they can apply, and as long as they meet the residency requirements and the citizenship requirements, then they could be eligible, and the income limits, they could be eligible for Healthy PA.
All right, we're slowing down with questions. So Jim did say the slides will be posted at PACHC's website under Outreach and Enrollment tab. What is Promise? Promise is it's our billing system for Medicaid providers. And is Healthy PA going to have a semi-annual application as well? Yep, it's an annual renewal, so no. All right, I think we don't have any more questions right now.
Well, we have one.
Oh, we have one more that's coming our way. And as soon as I get that, I'm not actually at the computer, that's why we've been printing these out and giving them to us. So we want to thank everybody for the great questions and for your interest in this. If you have any questions, please go on to our website. We have a ton of information and we're constantly updating it. December 1st, we will have a whole new set of frequently asked questions on the website available to everyone. We have trainings available on there. If you hit the training resources tab, you'll be able to see the Healthy PA 101. Anybody can watch that anytime. We also have a more in-depth presentation for the health screening, so if you have more questions about that, you can take that. MA will only cover this is the question we just received. MA will only cover childbirth. They do not cover prenatal care. Will this be different now?
It would depend on if they're eligible, income eligible, because for childbirth, so for pregnant women, they're eligible up to 215% of the FPL, and now the income limit is 133% for childless adults. So I guess maybe I'm not 100% understanding the prenatal care. I guess that maybe that's part of the package. I guess we can review this question.
Yep, and we can. What Jim actually just sent a message that any questions that you guys have after this, you can send to him, and we will then we'll be able to answer them. So we can send him more information on this one. Will consumers be notified about redetermination results through the mail? And I'm not sure if you're talking about redetermination on their plan. They would, if you're talking about them switching from Healthy to Healthy Plus, they would get a notice in the mail about that change.
Okay, so we got another response back. Dreamers can't apply on the marketplace. The 5-year bar needs to be, they need a resident for 5 years, not in the U.S. for 5 years. So, yes, this is from Brittany, and if you want to send your question through Jim to us, we can do more research on it as to whether or not they will be eligible for Health EPA. Again, today was the first time that I've heard of a dreamer adult, so.
So we learned a lot from everybody, and we appreciate everything that you're doing. Please, we are really encouraging people to help individuals apply for Health EPA. You might have already seen some commercials that are out there to let people know about this being available to them. And we will, if you need more information, we're going to have brochures available on our website. And anything else that we can do to help you, just let Jim know, and we will get in touch with you. And so again, if you have any more questions, you can send them through Jim, or you can go to healthepa.com, and there is an email address on the site for that. So I want to thank everybody, and have a wonderful day. Are you needed? We're good?
That was fun. I liked it better.
We're off.
And now you're off.
Oh, thank you. Thank you so much for being here. I could have never done this one by myself.
I like this better than like they can't like go back and forth. Like,
I know.
You can't get a response. I mean, they could send a follow up, but they can't
Right.
be like, what if?
Oh, I know. Well, and